My name is Joy Wan, and I'm the first author on the research team from the University of Pennsylvania Department of Dermatology that has recently studied the risk of infections in children and adults with atopic dermatitis. Atopic dermatitis, commonly referred to as eczema, is a very common skin disease among children and also adults. Eczema leads to changes in the skin barrier and the immune system, which may increase one's risk for infection. Commonly recognized infections in eczema include staphylococcal bacterial infections or herpes simplex virus infections of the skin. However, less is known about the risk of other types of infections and extracutaneous infections in patients with eczema. Thus, we conducted a cohort study using the Health Improvement Network, a large electronic medical records database from the United Kingdom, to better understand the risk of hospitalized infections, opportunistic infections, and several herpes virus infections among patients with eczema. We compared approximately 400,000 children and 600,000 adults with eczema to 1.8 million children and 2.7 million adults without eczema of similar ages and who were seen in the same general practice and time period. We found that both children and adults with eczema had a 26% to 40% greater risk of serious infections requiring hospitalization, with the greatest risk among those with severe eczema. Opportunistic infections were rare and not associated with eczema in children. However, adults with eczema had a 31% greater risk of opportunistic infections. Finally, both children and adults with eczema had a 50% to 52% greater risk of herpes simplex virus infections and an 18% to 33% greater risk of varicella zoster virus infections, with the degree of risk rising in parallel with the severity of eczema. Children with eczema also had a 2.5-fold increased risk of cytomegalovirus infection, and adults with severe eczema had a 4.5-fold increased risk of cytomegalovirus infection. All of these estimates remain similar after we excluded patients receiving immunosuppressive therapies for their eczema, suggesting that eczema itself increases susceptibility to these infections. Our findings are important to consider as new immunomodulatory medications continue to emerge for the treatment of eczema. An understanding of infections in eczema will be critical for informing treatment selection for our patients.